Hey guys, I'm Dr. Ramya Valivere. I'm a breast oncologist and endocrine surgeon working with KIMS hospitals. Many patients with breast cancer have been advised to undergo chemotherapy, and we have seen in previous videos how a chemo port is going to be very helpful for these patients. So here I want to answer two questions regarding chemo ports that patients often ask us. The number one question being, when are we going to remove this chemo port after the chemotherapy is done? And the second thing is, what care one should take while the chemo port is still in situ? So the number one question is, usually if we insert a chemo port, a good standardized brand chemo port, we can keep it in the body safely for about 2 to 3 years. So the reason being, if the patient requires additional drug or additional chemotherapy in the first 3 years where we expect the tumor to relapse, we want this access to be there. So it's not easy to keep reinserting the chemo port. So that's the reason why, especially for certain tumor biologies, we advise the patient to retain the chemo port for a couple of years. And while the chemo port is still there, what care one should take? First, you should not let anyone do an access to the chemo port. A trained nurse or a doctor should only give insertion or access to the chemo port. There's no longer therapy that is being given, every month there has to be a flush that should be injected into the chemo port, which keeps the line patent. So there is going to be blood when we use the chemo port, so we don't want the chemo port to get blocked. So every monthly once, you can go to a trained nurse or a doctor to get your chemo port flushed.